The AO method of internal fixation. The AO method of internal fixation are based on achieving AO method of internal fixation are based on achieving interfragmentary compression or splintage or both. Plate and screw can be used to achieve this. Plate and screw can be used to achieve this. Nailing is a splintage device. Interlock nailing being recent modification. Plate and screw used to achieve this. Nailing is a splintage device. Interlocking nailing being recent modification. In the treatment of diphageal fracture, emphasis has shifted from rigid absolute stability to relative stability. Anatomical reduction has been replaced by functional reduction. Anatomical reduction has been replaced by functional reduction. Plate fixation has undergone change to make it more biological implant. Plate fixation has undergone change to make it more biological implant. Locking compression plate is a recent addition to plating technique. Functional bracing is a non-operative method of treating fracture of long bone. Elizarov method is a type of external fixator system which is versatile in its application, particularly suited for difficult union, malunion, and limb lengthening discrepancy. Kramer wire, common splints and braces. Kramer wire, emergency immobilization. Kramer wire, emergency immobilization. Thomas splint, femurs, fracture femur anywhere. Thomas splint. Bowler Brown, fracture femur anywhere. Aluminium splint, immobilization finger. Aluminium splint, immobilization finger. Dennis Brown splint. Congenital talipes equinovarus. Cockop splint, radial nerve palsy. Knuckle bender splint, ulnar nerve palsy. Cockop splint, radial nerve palsy. Knuckle bender, ulnar nerve palsy. Toe raising splint, foot drop. Volkmann splint. Volkmann ischemic contracture. Four post collar neck immobilization. Aeroplane splint, brachial plexus injury. Somi brace, cervical spine injury. ASHE, anterior spinal hyperextension. Dorsal-lumbar spinal injury brace. Taylor brace, dorsal-lumbar immobilization. Milwaukee brace, scoliosis. Boston brace, scoliosis. Lumbar corset, backache. Kramer wire splint. Inner bar, outer bar, notch, curve, ring. This one is 120 degree. Thomas splint. Bowler Brown splint, 1 2 3 poly. Bowler Brown splint. Comparison between skeletal and skin traction. Skin traction required for mild to moderate force. Used for children. Applied with adhesive plaster. Applied on skin, common side below knee. Weight up to 3 to 4 kg. Used for short duration. But skeletal traction, mild to severe force, mild to moderate force skin traction is used for children. Skin traction, adult. Skeletal traction, adhesive plaster, skin. Steinman pin, K-wire, skeletal. Through bone, skeletal. Upper tibial traction, escalator up to 20 kg escalator, long duration. 3 to 4 kg is skin. Below knee, skin traction on skin, short duration. Steinman pin, leucoplast, skeletal traction, skin traction, skeletal traction. Gallo traction, fracture shaft of femur in children below 2 years, fracture shaft of femur in children below 2 years. Brain traction same. Russell traction, trochanteric fracture. Russell traction, trochanteric fracture. Gallo traction, fracture shaft of femur in children below 2 years. Brain traction same. Russell traction, trochanteric fracture. Buck traction, conventional skin traction. Buck traction, conventional skin traction. Perkin traction, fracture shaft of femur in adult. Fracture shaft of femur in adult. 1990 traction, fracture shaft of femur in children. Fracture shaft of femur in children. Well leg traction, correction of adduction or abduction, deformity of hip. Correction of adduction or abduction, deformity of hip. Well leg traction. Dunlop supracondylar fracture of humerus. Smith traction, supracondylar fracture of humerus. Calcaneal traction, open fracture of ankle or leg. Metacarpal traction, open forearm fracture. Metacarpal, open forearm fracture. Cervical spine injury, head halter. Head halter traction. Crutchfield traction, cervical spine injury. Halopelvic traction, scoliosis. Now this one is the last. Splints are useful and readily available method of immobilizing a limb. Due care is required while treating a patient in a splint. There are two types of traction, fixed and sliding. There are two methods of applying traction, skin, skeletal. Skeletal traction is more convenient for giving traction for long duration. Also, more weight can be applied by skeletal traction. Skin traction is suitable for short-term traction only. How to take proper care of patient in traction. Skin traction is contraindicated in skin damage, deep vein thrombosis, significant vascular deficit, and neurological deficit. Thank you.